I'd like to address a few of the comments that we heard earlier and put a face to some of the discussion that we've had so far. I think that the good representative from Wyndham is correct in that in expanding our health care to 70,000 acres, it's counterintuitive that it will ultimately save money. But I think I can give you a personal example of where it will. And I think that our good representative from Chelsea may have, she's absolutely right. We have a waiting list for our most critical medical cases, as our good representative from Hancock had as well. And those people have been on those waiting lists for a long time, and they deserve the medical care that they desperately need. My sister passed away about a year and a half ago at the age of 47. And for the final year of her life, I was her guardian. She lived down east in Lubec. And I petitioned the probate court in Machias to gain custody of her, even though she was married at the time. My sister, for many, many years, was one of those individuals who fell through the cracks and did not get health care. Her problems initially were relatively minor. But over the years, they became exasperated and chronic, to the point where, when she was 46, she went into her first coma. It was at that stage that she was life-flighted from Machias to Bangalore. And at that time, that was a $25,000 fee to the state of Maine. That fee alone right there would have covered probably 5 to 10 years worth of medical care for her, had she been able to get medical care back in her 20s. It was at that stage that my brother and I were able to get her Social Security benefits through the federal government, which then enabled me to get her Maine care through the state of Maine. For the final 6 months of her life, the state paid about $250,000 to keep my sister alive. What the unfortunate part about this, and my sister had to wait, she was on the waiting list, she never got to the waiting list for a liver transplant. But had she survived, she would have been on that waiting list for several years. Ladies and gentlemen, my sister is a real person. My sister was one of the closest people to me. I loved her. And I still love her today, and I miss her every day. My sister died unnecessarily. My sister died because she didn't have access to health care for many years. The expansion of health care for Maine will take a lot of people who are presently in the position that my sister was in the last 6 months of her life. They'll never get to that stage. Preventative care, health care maintenance at a young age, diabetes, opiate addiction, heart disease, mental health care. These are things that we need to get on board now and stop. We can't wait until people are in my sister's condition and become an absolute burden. My sister cost the state $250,000 for 6 months. That's wrong. That was a huge waste of money that did not need to happen. So this is why the expansion of health care is actually going to be less expensive. Because we're going to have fewer people that are going to have diabetes. We're going to work with these overweight children. We've got to stop opiate addiction before people take that pill for the first time. People live healthier lives. They're not going to cover as much heart disease. And when people start to have mental issues, that they get the mental health care they need before that mental health, their issues erupt into full-blown mental problems in which there's no return from. And the good representative from Hancock is absolutely right. People do not value health care enough. When I ran unsuccessfully in 2010, I asked 2 doctors, what he said, you know what we need to do? We doctors need to take responsibility for the health care that we provide. I said, yeah, that makes good sense. The other doctor that I asked said to me, I have patients that come in and have a $2 or $5 copay. And they have a pack of cigarettes right here and they complain to me about the copay. He said, what we need are patients to take responsibility for the care we receive, for the care they receive. I am totally on board with what the good representative from Maine House says. But without an expansion to those who cannot presently afford health care in Maine, we've got another generation coming up who are going to be in the same position as my sister, and they're going to become a burden to the state. It's going to be unnecessary. Thank you very much, Mr. Speaker.